On December 13, 1945, a 22-year-old woman stood on the gallows of Hamel and Gaul. As the executioner adjusted the noose, she uttered a final defiant word, Schnell, meaning quickly. Her name was Irma Grese, the youngest woman executed under British law in the 20th century. To the world at the 1945 Belsen trial, Irma Grese was a paradox, named the beautiful beast of Belsen, not only for her beauty, but for her inhuman sadism. Grese was the epitome of a Nazi Aryan poster child. Witnesses described her as having natural blonde hair, clear blue eyes, and a perfect body. Yet, behind this angelic clarity lay a woman survivors called the hyena of Auschwitz and the beautiful beast. In July 1942, Grese began her career at Ravensbrück as a trainee appointed as a female overseer or guard. She was then transferred to Auschwitz-Birkenau, where she was promoted to senior SS supervisor, the second highest rank achievable by a female guard, and later given command over a women's camp with absolute power over 30,000 female prisoners. One of her most notorious roles at Auschwitz was assisting Dr. Joseph Mengele in selections for the gas chambers. Survivors testified that she personally chose victims for death and used extreme violence, including a cellophane whip and heavy boots, to force prisoners back into line if they attempted to hide. Her many acts of sadism were detailed at the Belsen trial, and the beast was revealed through harrowing eyewitness testimonies. Yet even in her cruelty, there were glimpses of ordinariness, moments where she gave extra food to certain prisoners, a detail that makes her lack of remorse even more disturbing. Whether as a disturbed killer or an ideological careerist, Grese used her absolute power over 30,000 women to indulge in stunning evil.
How does an ordinary girl from a dairy farm become an icon of evil? To understand Irma Grese, we have to look at the relational trauma of her home life and the cultural machinery of the Nazi state that filled those voids. Irma's story begins in the rural Mecklenburg region, a landscape that perfectly matched the Nazi blood and soil ideology, which idealized farmers while vilifying urban decadence. Her childhood was defined by a profound relational collapse. In 1932, when Irma was just 9, her mother committed suicide by drinking hydrochloric acid, reportedly due to the marital problems with Irma's father, Alfred. Alfred was a stern and strict disciplinarian who frequently used beatings to control his 5 children. This creates our first factor, suppressed inner rage. Psychologists suggest that the lack of a maternal figure and her father's oppressive rule created a resentment that she would eventually release through the exercise of absolute power she held as a camp guard. Her transition to the Nazi Party was, in part, a rebellion against her father, who forbade his daughters from joining Nazi organizations. For Irma, the League of German Girls, or the BDM, wasn't just politics, it was a recreational release from a rigid home life. Her commitment to the SS caused a permanent rift with her father. When she informed him of her work at the camps, he beat her and disowned her, telling her never to return home. This rejection reportedly caused a festering resentment and animosity that further hardened her personality. By age 10, Irma was already a susceptible and willing convert to Nazism. The Enabling Act of 1933 mandated Nazi education in her elementary school, ensuring her worldview was shaped by the state before she even reached puberty. Her professional life furthered this radicalization. At the Hohenlohe SS hospital, she was trained as a nurse's assistant and worked under Karl Gebhardt, a man close to Himmler who performed agonizing bone grafting experiments on living subjects. This was likely Irma's first exposure to institutionalized sadism. She was no longer just a farm girl, she was being socialized into the SS habitus, a collective environment where violence was standard for hardened devotion. The final transformation occurred in July 1942 at Ravensbrück. Irma was 18, and in just 3 weeks of grueling training, the SS cured her of the initial politeness and humanity toward inmates. Her training was specifically designed to harden her. Her lack of remorse is explained by the camp's hermetically sealed micro-society, which operated under a local moral framework. She likely trained under Theodor Bintz, a notorious sadist who served as a lethal role model. This process instilled a fanatical devotion to the Nazi racial ideal that replaced individual conscience with the collective habitus of the SS, characterized by group conformity and terroristic overregulation. In this environment, the Dachau spirit or cult of severity prevailed, meaning that brutality was the required norm and failing to be severe or being kind to prisoners was seen as a sign of weakness or deviance that could lead to being demoted or punished herself. SS guards were integrated into the lifestyle that included monstrous eating and drinking bouts and encouraged sexual relations between male and female SS members, creating a specific social environment that reinforced their status as a master race. By the time she reached Auschwitz at the age of 19, she had adopted the cult of severity, viewing brutality not as a deviation, but as a necessary conformity to the local moral framework of the camp system. She began carrying the cellophane whip, a holstered pistol, and wearing the heavy boots that would become her trademarks of terror. Irma Grese was not a marginal sociopath born in a vacuum. She was an ordinary woman whose relational trauma at home made her a willing convert to the culture that rewarded her worst impulses. The beautiful beast was a product of a state that turned the gender order upside down, replacing the angel of the house with a woman out of place, one who found her identity in the dirty work of the Holocaust.
When we look at Irma Grese through the lens of empathy and human understanding, in some senses it seems easier to connect to her humanity due to her age, but then also, because of her age, hard to wrap our minds around the atrocities she so brazenly committed. Hannah Arendt, a German and American historian and philosopher, coined the phrase "the banality of evil" after sitting through the trial of Nazi SS officer Karl Adolf Eichmann. We like to think that only people not like us could commit the atrocities of the concentration camps. We split off the monstrous and the evil. But in doing so, we objectify and dehumanize the very real humans who committed these atrocities. And when we do that, we also dehumanize ourselves. Hannah Arendt was most struck by the dissonance between the perceived image of Eichmann, the man monster and Jew hater, and the real, innocuous, and completely ordinary individual she saw at his trial. Seen through the eyes of the Nazi ideology, the concentration camps made sense. The banality of evil was Arendt's term for this normalcy and consistency to their ideology in ordinary individuals. She saw totalitarian evil as birthed in a form of thoughtlessness. Irma Grese was an ordinary German girl, and she was very young. It is difficult to hold the atrocity she committed together with the fact of her age. Could she be the extreme Nazi version of our society's high school mean girls? What are the systems in our culture that carry the seeds of harm, objectification, othering, and dehumanizing? Where am I complicit with those systems? Where am I thoughtlessly joining with a group or system, not thinking about who is being harmed? As a human girl, Irma Grese was created to be seen and known and loved. In what we know of her history, she experienced little of that care. Adding the trauma of her mother's suicide and her father's brutality, along with her failed attempt to become a nurse, it is not hard to see how her full embrace of Nazi ideology made sense. It offered belonging, purpose, validation, approval, strength instead of weakness, success instead of failure. And it is at the same time shocking and hard to hold without splitting. When we split ourselves off from those who could commit such atrocities, if we can't see the seeds of possibility in our own humanity, we are in danger of replicating such horrors. I visited the Dachau concentration camp as a 16-year-old exchange student, just a few years younger than when Irma became an SS guard, and 6 years younger than she was when she was executed. There is a sign at Dachau that says, "Those who cannot remember the past are condemned to repeat it." I would say the same is true of our ability to commit and justify atrocities against other human beings. If we cannot see and tolerate and think about our own disturbing connection to the humanity of the perpetrators, we are vulnerable to repeating their behavior to one degree or another. I think the ability to avoid collapsing into either condemnation or justification is a very real and current need in our society, not just with perpetrators of atrocities. It requires a capacity not just to think, but also to feel to suffer, to see and grieve the harm done to the victims, and at the same time to see and grieve the harm done by systems and sometimes self-inflicted to the perpetrator. There is human harm and suffering on both sides. It takes a capacity to grieve, to suffer, to sit in the pain that cannot be resolved. Francis Weller, in his writing on grief, says that trauma always carries grief. It is essential for us to welcome our grief, whatever form it takes. When we do, we open ourselves to our shared experiences in life. Grief is our common bond. Opening to our sorrow connects us with everyone, everywhere. We need to be able to grieve in order to not collapse into the split. We need to be able to think, to not join with dehumanizing systems.
There is no historical evidence that Irma ever received psychotherapy or psychiatric treatment during her life. Records from the trial and biographies do not mention formal psychological therapy or diagnosis. And while our group was initially quick to want to diagnose Irma with antisocial personality disorder, purely based on the horrendous sadistic acts of violence and the pervasive pattern of disregard for and violation of the rights of others, the more we studied the entire life of Irma, we decided that we could not actually make that diagnosis, and that we would focus more on her Nazi ideological indoctrination, early life trauma and instability, and concentration camp power and system effects, and her sadistic personality traits while creating treatment implications. Firstly, we would like to state a key ethical principle while working with Irma. Therapy would never aim to excuse or minimize her atrocities. Moreover, Irma's therapeutic goals would include developing accountability and moral responsibility for her actions and crimes. Other clinical goals would include reducing ideological extremism and dehumanization of Irma's Nazi indoctrination, and lastly, helping Irma process childhood trauma if possible. Based on records from the Belsen trial, it is likely that Irma would present in psychotherapy with the same cold, arrogant, and unremorseful demeanor that she displayed during the trial, showing a strong sense of indifference. And because Irma's history of sadistic behaviors and getting gratification from hurting, humiliating, and controlling others, the therapeutic stance and relational approach for the therapist must take is incorruptibility. The therapist must be uncompromising in honesty, talk straight, keeping promises, and making good on threats, and persistently addressing reality. Any behavior of the therapist that is interpreted as weakness and vulnerability probably will be. The therapist must have hard boundaries and be tough-minded and exacting. While working with Irma, the therapist may feel anger, moral outrage, and even hate. It is common for therapists working with clients who have committed atrocities or extreme violence to feel many unempathetic feelings. McWilliams says that a therapist could also experience internal coldness and worry that clients have them under their thumb. The fear of intimidation when working with someone capable of extreme violence can create feelings of anxiety or fear, especially if Irma displays hostility, manipulation, or lack of remorse. Lastly, the therapist may feel intense hostility or hopelessness with how difficult it is to challenge Irma's extremist and dehumanizing beliefs. Therapists may feel that meaningful change is unlikely, particularly when Irma shows little empathy or responsibility for her actions. Supervision and consultation will be non-negotiable when working with Irma. This is essential to maintain ethical clarity, minimize blind spots and biases, and effectively manage countertransference. Irma's childhood trauma and instability may have made her more vulnerable to Nazi ideological indoctrination during adolescence, a time when she was likely searching for identity and belonging. For a therapist working with Irma, it would be important to understand the cultural and political context in which she was immersed. Irma was deeply influenced by Nazi ideological, which promoted beliefs in racial supremacy, anti-Semitism, authoritarian rule, and extreme nationalism. Therapy would focus on challenging Irma's extremist and dehumanizing beliefs, addressing cognitive distortions that portray non-Aryan people as inferior, and helping replace ideological thinking with ethical, humanistic perspectives.